Hello and welcome to today's Physical Therapy and Musculoskeletal Healthcare and Rehabilitation MSc program virtual open day. Thank you very much for joining us. My name is India Dean Smith. I'm an MBBS student at UCL and I will be your chair this afternoon. We hope this session will address those course-specific questions that you may have had and will help you to gain an insight into what it's really like to study on one of our master's programs. I'm delighted to welcome today's speaker, Dr. Peter Snow, who will provide you with a summary of our Physical Therapy in Musculoskeletal Healthcare and Rehabilitation MSc program. You'll be able to ask questions to Dr. Snow and myself during the Q&A part of the event using the Q&A function. This session is being recorded and will be made available on our website following today's event. Now to introduce our speaker, we have Dr. Peter Snow. Peter is a lecturer in minimally invasive surgery and a research fellow in rehabilitation robotics located at the Aspire Create Lab and Weiss Centres working at the Royal National Orthopaedic Hospital in Stanmore. Peter is also the program lead of our Physical Therapy in Musculoskeletal Healthcare and Rehabilitation MSc program. Over to you, Peter.
Thank you, India. Thank you very much for a very good introduction. And thank you everyone for attending. I hope you're having a good day and a good evening. So yes, I'm Peter Snow. I'm the program lead here at the Royal National Orthopaedic Hospital, IOMS, which is the research department that I'm based at. So I'm just going to share my screen. We have a presentation for you. But there'll be plenty of time to ask questions okay, so you should be able to see my screen now.
Yeah, we can see that.
Perfect. There's one of those things about online presenting, you can never tell what you're looking at. So yes, thank you for attending. So this is going to be a short presentation to give you some more information about the MSc program that I'm currently the program lead for, which is physiotherapy in musculoskeletal health and rehabilitation. So first of all, what is the main takeaway of the program? Well, it's a very, very unique program that's been running now probably for about 10 to 12 years. And what makes it unique is the fact that it focuses on the very, very core principles of biology and scales them up right from cellular right through to rehabilitation. Normally on some physiotherapy courses, you'd be trained on procedures and then why you're doing them. But here we take a very intuitive approach by going and looking at the cellular level and then working the way up, looking at disease, and then finally going on to how clinicians actually day-to-day treat these pathologies. So you probably heard me say that I'm based at the Royal National Orthopaedic Hospital. I don't know if you know where that is, but basically it's at Stanmore, which is where I'm actually physically sitting in right now. And the department is called the Department of Orthopedics and Musculoskeletal Science. What makes us very unique, and it's one of the very, very few places in the UK, is the fact that we are physically based in the hospital. So we get unparalleled connections and opportunities to actually work with very, very specialist clinicians here at the Royal Orthopaedic Hospital in Stanmore, and also around as well. So UCL also has sites, for example, in neurorehabilitation at Queen Square, at the Royal Free. So although I'm giving a talk to you about the department at the Royal National Orthopaedic Hospital, there are additional sites that we do work with as well. So why the Royal National Orthopaedic Hospital in Stanmore? Well, there's actually two sites. There's one in central London, Bolsover Street, which was originally established in 1903. And this was with a merger of some other sites within the mid-19th century. So orthopedics at the Royal National Orthopaedic Hospital has been around for a very, very long time. And where I'm based now, at Stanmore, was established around about 1922. Originally, it was a military hospital, and actually previously before that, they had some work on diseases such as uh, different types of very spreading diseases. So because it's in the middle of nowhere, it's one of the very few national centres of excellence in the UK, specifically for orthopedics. Some other hospitals are specialising in things like cancer, but here at Stanmore, we only do orthopedics. We don't do anything else. And in 1948, it was one of the very first places in the world to conduct a hip replacement. And the same hip replacement that was actually installed in 1948, back now in 2016, was still going with the person that it was actually implanted in. So it was actually the world's oldest hip replacement implants that happened here in Stanmore. Um, I believe this is actually slightly out of date. I think we are now the 12th in ranked in the world for orthopedics. So that gives you kind of like a general feeling as to why we're based at the Royal National Orthopaedic Hospital. You might be able to see in the bottom of the screen the Google directions from University College Hospital at Warren Street, Euston Road, to the Royal National Orthopaedic Hospital. 50 minutes. Yes, it is out in the absolute middle of nowhere, as you can see on the image on the right. However, there's a reason why that is. Not only is it one of the best places in orthopedics in the country, but the world, but the other reason why is the clinical professionals. They are the ones who will be partly teaching you. The program is made up of lecturers, professors, but more importantly, there are component modules which are taught solely by the clinicians here at the Royal National Orthopaedic Hospital. That's very unique. And because we're one of the best centres in the UK and one of the best in the world, you're getting the best of the best to teach you. So it's an absolutely golden opportunity. And I really do stress to the students to take every opportunity you can, including shadowing clinical professionals, which you get opportunities throughout the course to actually shadow and learn from them as well. So really, it's the quality of the staff that work here are the reason why the RNIH is a success, but also it actually makes the program a success as well. So what do you learn? So that's the reason why we're here, but what do you learn? So masters here in the UCL and the UK as a whole are made up of 3 terms. So term 1 is from the beginning of the academic year. So that's probably the last week of September, beginning of October, all the way through to, well, actually, it's middle of January. You have a Christmas break as well. So on term 1, you do 4 modules. Now, the modules on this course throughout the years have not really changed in terms of the structure and where they're placed. The reason why this is because it tells a really good story. And this starts from when you learn about musculoskeletal tissue biology, the form and function. So right down from the cellular level of ligaments and muscles, the basic building blocks of MSK tissue biology. And you'll see why you teach this in the next term. But this module is very biological based, but actually gives you a really good grounding. The second module you do is what we call musculoskeletal biomechanics and application to physiotherapy. This is a joint module with the other MSCs that we actually run here at Stanmore, which are in MSK and Rehabilitation, Engineering and Assistive Technology. And the reason why you learn the biomechanics is because this is core to understand the actual forces that take place on the human body. So here we can see a classic example of a hand holding a book. Understanding the forces that are applied to the arm and how that affects the human body is vital in actually understanding and actually becoming a better scientist and clinician as well. One of the major concerns that people have is the fact that you're probably looking at that and you're seeing lots of numbers and lots of figures. My advice, and I always say this to the students, is don't worry. It's taught very, very well. There's lots of practical examples. You learn by doing. Yes, there's a little bit of maths, but a lot of people do very, very well. And a lot of students who are very hesitant actually really enjoy the module as well. Then we have a module called Movement and Science and Pain, and this is in collaboration in the hospital. The hospital has what we call a motion capture lab, which is very similar to the picture on the bottom right. And this comprises of quite a large room where you have a treadmill, which has got 4 sensors. And the treadmill can pivot up and down, it can change speed, but most importantly, we can use markers placed on the body to see how you're walking, your gait. And this is very, very important when it comes to physiotherapy and rehabilitation, because then we can see a change in, let's say, for example, if you have had a severe accident which has affected your hip, how your walking gait changes over time. And we can see using the actual the mobility lab, which you'll get to experience, you'll get to have a tour, you'll get to take part in taking recordings. And what we do is we take a case study for this, and we basically look at how the gait data has actually changed during treatment. And lastly, for this term, we have a module called Research Methodology and Transferable Skills. And this is really one of the core modules which you'll need to actually understand in order to do the day-to-day final part of your course, which is your project, which everyone has to do then. So that's taking you through step by step how to create a proper research project which is thorough and is scientifically proven, and that will get you the best grades that you can get. But also that's transferable to your day-to-day work in the future as well. So that's term 1. By the end of term 1, you're exhausted, but you do have a bit of a break. And that's when you come on to term 2. And that begins roughly end of January until about, in fact, actually, the end of term 2 this year is actually next Friday. And for that term, you do 4 modules similar to term 1. So remember when I said this course has been told to tell a very nice story? Well, in term 1, you looked at tissue biology of a healthy, from the cellular level. One of the first modules that you do for term 2 is you take that and you look at the disease and the dysfunction states that we often see here at the hospital at a cellular level. That's very important because that infers how you treat a patient. So, for example, on the top right, you can see examples of slices that have been taken from a patient of both normal and loss of fiber in the muscle. So you get to have that knowledge, again, building on what you learned from term 1, sorry. Then you have a clinical aspects of musculoskeletal medicine. And again, that is in conjunction with consultants and surgeons here in the hospital. And they will take you through the process of looking at medical imaging, looking at clinical decisions, surgical decisions, the steps that are taken from when a patient comes to the hospital to when they're an outpatient. Which leads on to the 3rd module, which is all about rehabilitation. And again, that's in conjunction with the hospital. And that's when you learn and you get to go and shadow clinical staff in how we actually structure rehabilitation, learning from what you've learned in the clinical aspects of medicine. So you see the whole picture from initial injury to initial treatment to rehabilitation and then discharge. So these are all not quite hands-on, but more shadowing, more understanding the actual patient pathway. Lastly, you do something which is very important, and especially for your research project, and that is you look at research governance. So, for example, good clinical practice, understanding the difference if you're looking at, for example, the human tissue laws and the actual governance surrounding those. So that will give you a good grounding for potentially your project, which we'll talk about in a second, but also your future careers. And that brings us on to your final term, because the academic year is a calendar year. And you see, well, slightly less than a calendar year, and that's the research project. Now, research project is one of the things students panic about, but actually it's probably the single most important module that you do. And the reason why is because it's very personal to you as a research project. My advice to students is to choose something that you have a passion about, because you've got 3 months full time to do it. Good students start before, but basically this is an opportunity to actually take what you've learned during those 2 terms and potentially apply it to something that you would like to do in the future. So my advice to students is focus on something that you really have a passion for, but something that will challenge you and something that you want to do in the future. So these can be based in a lab, they can be a clinical study, or they can be a what we call a desk-based project. So for example, a systematic review. And they are very flexible in terms of your supervisors. We usually do provide a list for students who are a bit unsure. However, we are more than happy for students to actually suggest their own research as well. And we can see some examples here. And these are all previous examples. So these are the titles of their projects. So hamstring muscle injury in athletes. How can increasing injury rates be addressed by investigating how to optimize hamstring function / prevention and post-injury rehabilitation? It's a bit of a mouthful. My advice is choose one that's a little bit slightly shorter. Cycling your way to well-being. Designing, for example, a neck orthotis for patients suffering from neck drop, interventions to actually facilitate hand dominance transfers in adults with an upper limb impairment, a systematic review. So as you can see, these are really quite research active. You don't have to do something which is completely new, but it does benefit you and also benefits your career, especially if you get a publication out of it. But really it's your chance to imprint what you're passionate about and what you want to do in the future. So once you've done all of that, you can breathe a sigh of relief because you've finished your master's course. So how do we assess you? The main thing is the fact that we build on on the skills that you learned for your course. The assessments are now quite varied, and they're authentic, which basically means that they are based on real life problems. So for example, we could have multiple choice question exams, which are usually conducted online, courseworks, written courseworks, case studies. The module which is run in term 2 for rehabilitation by the hospital, we have a poster presentation where clinicians will actually ask you to talk about your coursework, and then we'll ask you questions. And then you've got your research thesis / dissertation, and then a project viva, which is basically a short presentation, and questions from 2 examiners. So really, the assessments are quite varied. They do change by year to year, but generally it's a mixture of them. So who will benefit from this program? Well, if you're watching this, the answer is yourself. But generally, physiotherapists, you do not have to be a qualified physiotherapist to actually take part in this course, which is unique, but also has some positives as well. So general physiotherapists, medical professionals, GPs, rheumatologists, nurses, people interested in sports science, because you can apply what you've learned here in the future to sports science. And even people with a biomedical science or even a bioengineering kind of background as well, so long as they have an interest in musculoskeletal healthcare. So really, the types of people who will benefit from this program are people that really want to get real world knowledge from experts to apply in their future career in musculoskeletal health. So what will you be able to do at the end of of the program, other than lots and lots of coursework? Well, that coursework actually incorporates skills such as improving general cognitive skills, more importantly, getting you to think creativity, especially with your projects, because it is you coming up with the idea, you planning the research, and you conducting it. Skilled in analytics and evaluation, because we want you to go out into the workforce and actually be a leader. And in terms of careers, we have people who have gone on to be physiotherapists in the NHS or private practice, education lecturers. Some students have actually gone back to their home countries and become lecturers. Some have decided to stay on and do a PhD, including me. Not on this course though. Some people have gone into health service management, and some have even gone into industry as sales representatives for companies that provide MSK solutions or products as well. So there we are. I don't know how we're doing with time. So it's about 25 minutes. But yeah, if we've got any questions, I think the best way is to have a conversation and take it from there. Thank you.
Great. Thank you, Peter, for this very informative session. So we'll now start our Q&A. So please do add your questions into the Q&A box, which you'll be able to see at the bottom of your screen. And we'll just wait for some questions to come in.
I guess one thing I could ask is where people are from. Are people from the UK, Europe, further abroad? Yeah, it'll be interesting to hear from people, or what your background is, or even what made you sit through 20 minutes of me talking.
And just sort of from your perspective, what do you think are the unique points about this master's program compared to others that are offering sort of a similar course?
So within UCL, the majority would actually the requirements are to be a registered physiotherapist. We don't have that requirement, which is pretty unique. The course itself does not lead to any qualifications which you could then apply to be a clinical physiotherapist, but there are skills that you could build up on. And that's good because then you get a mixture of students and different backgrounds. And then from the wider UK education sector, I think it's the fact that we're based at the Royal National Orthopaedic Hospital. We have not just contacts here, but also in Queen Square for neurorehabilitation, even things like cardiovascular rehabilitation at the Royal Free. Yeah, we've got UCL, as I'm sure you're aware, has lots of fingers in lots of pies, so it's very well connected. I think that's the massive positive.
Great. Yeah, no, it definitely is. We've got lots of hospitals at our disposal. We have a question. So our first one is, hey, I am from India and I'm a dentist. Was hoping if I could expand my knowledge via this course.
Yes, and very interesting to be a dentist to do physiotherapy, but again, very complementive. So yes, then and that might even open up possibilities after the course. Who knows? You might go from being a dentist to actually going purely into physiotherapy. So I think the one benefit is the fact that see the course as a course for physiotherapy, but also see it as a course which allows you to expand other skills as well. Um, so yes, dentistry. In fact, dentistry you probably have some slight advantages, um, especially when it comes to working out forces of the jaw. But actually, I think anyone with with an interest should actually consider applying.
Great, thank you. And I'll just leave it a few more minutes to see if we get any more questions. Um, is there somewhere that students, if they think of questions at a later date, they can sort of contact and get in touch with the course leads or?
That would be me. Yes, I'm sure we can get my email out to attendees via the feedbacks. I believe that we are giving feedback. So I'm happy for people to contact me. Yeah.
Okay, great. Okay, so it looks like we don't have any more questions. Um, let me just double check. Okay. All right. Well, if there aren't any more questions for today, we can wrap up there. So yeah, and we've just got your email there in the chat as well. So for anybody that thinks of questions at a later date, then yeah, they can get in touch. So thank you very much, Peter, for that excellent session.
Thank you.
And have a great evening, everybody.
Thank you. Well done.